Ladies and gentlemen, please take your seats. The program is about to begin.
Good morning, everyone. There we go. There's some volume. Thank you so much for joining us, and it's so wonderful to see everyone together, chatting, talking, eating. We have a slate of fantastic programming at FP this week at UNGA these next few days, and we're kicking it off right now with a very important discussion on health and climate. Those are actually two of the key topics that we're talking about. To combine them in one very important discussion is special for us. We're pleased to start with this program with a partnership with Foundation S and Africa Europe Foundation. They have done fantastic work focusing on how to source financing for climate adaptation in order to achieve health equity. And we have got a fantastic lineup of speakers for you, and I'm going to get out of the way and let them talk in a moment. It includes the President of Malawi, the Ministers of State of France and Senegal, the Assistant Director of the WHO, the CEO of the WHO Foundation, and Vanessa Carey. We're very excited to have all of them here speaking with us today. A couple of housekeeping items. How to ask questions. If you're joining us online, you can submit your questions right on the website. You'll see a space for that. And if you're here in the room with us, you'll see on your seats a QR code that you can scan, and you can submit a question, and my colleague Claire will vet those for the speakers and pass them up to the front of the room. One of the most important things that we're doing today is talking about a new report that was just launched by our partners. It's titled Accelerating Climate Adaptation for Health Equity, Catalyzing Solutions for Community Action. You can access the report by using that QR code on the opposite side of that handout. And please do have a look. It's a fantastic report. I've read through it, very informative and easy to read. And I'd now like to pass the baton on to Vanina Laurent-Ledru of Foundation S, who will help frame the discussion for us. Vanina.
Thank you so much. Hi, everybody. So my name is Vanina, and I'm the head of director, and I'm the Director General of Foundation S, the philanthropic organization of Sanofi. So in a not too distant future, many of us in this room might one day get a climate change diagnosis, as a doctor in Canada did just 2 years ago during the heat wave that impacted Vancouver and British Columbia, as he was seeing far too many patients with heat exhaustion. But people are dying from climate change. People are dying today of climate change, which has become our biggest health crisis. I don't know if you knew, but more people die of air pollution every year than during the entire pandemic of COVID. People in Libya, in Pakistan, in Malawi, whom we will hear from, died from massive floods and their ensuing health consequences. So this is why we have partnered with Africa Europe Foundation to convene the Collective Minds Climate Council to identify what can be done to address the health impacts of climate change, as there was literally no time to waste. You will hear from members of the Council today on the outcomes from a year-long analysis and dialogue on how critical it is to support community-led adaptation programs. Indeed, only 5% of the entire multilateral climate funding today goes to adaptation. And out of these 5%, only 1% to health programs. In total, it represents $11 billion to help poor countries adapt to extreme weather. One might think that it is okay as a sum of money, but consider this. People in the US spend 4 times that every year on digital entertainment alone. So we are bringing solutions today. We're bringing this report that identifies solutions from the communities themselves. We hope you can join in supporting this. And on our side, Foundation S is pleased to announce a $40 million actually euros, 40 million euros commitment to support climate adaptation and increase health resilience in the communities themselves. Thank you. We're making this announcement because we hope it will be the first in a series of many. We hope that you can join us to support community-led adaptation programs, and we hope that the disasters left after Storm Daniel in Libya just recently, or Cyclone Freddy in Malawi, are a stark reminders that we should collectively fix the roof while the sun is shining. So in other words, the time to adapt is now. You have the report on your seats, and for those online, you have it as well on the website. Please join us in identifying the solutions, supporting them, and we thank you in advance for your time and consideration. Pleased to introduce the Assistant Director General for Healthier Population, Ms. Eileen Lee.
Excellencies, dear colleagues and friends, on behalf of WHO Director General Dr. Tedros, I'm very honored to join you all today. I would like to start with my heartfelt appreciation to our organizers for convening this very high-level, important dialogue on climate and health. The climate crisis is a health crisis. Our everyday lives are at high risk, and our whole communities are being threatened. The health impact of climate change are right here and right now with us. There's no time to wait to see, or there's no time to waste. It's time to act with a great sense of urgency because many lives depend on our action today. Small communities are particularly vulnerable. They are often not prepared, not ready, not equipped to respond to climate events, as we can see over past months and years. In WHO, we have made climate and health as a specific strategical priority now and for the future. We are working to support our member states in partnership to strengthen climate-resilient health system so that health impact of climate change can be minimized, including particularly at community level. We are working to strengthen health sector's leadership and capacities towards climate change. But we are also jointly working with other sectors to achieve co-benefits that enhance health equity, and sustainable development. Today, let me highlight 3 priorities for climate action on behalf of WHO. First, we need to raise our joint voice for health as one of the most important reasons for climate action. We need to act with solidarity and more effective collaboration. We have a good news here. We are very grateful that more than 70 countries and many partner agencies have now joined so-called Alliance for Transformative Action on Climate and Health. This is a newly established global alliance, coordinated, supported also by WHO. I urge each of you to join this network and also to advocate for others to join. Only we have more people in this network, and we can act better. Second, we need to lead by example. I don't know if you are aware, but the health sector is also responsible for almost 5% of global carbon emissions. We must enhance climate-resilient health systems and healthcare facilities, including with the participation of communities. WHO and the partners are working very hard and are making progress, including in the electrification of the healthcare facilities through solar energies. In sub-Saharan Africa, can you believe only half of hospitals have access to reliable electricity? If I may say, this is not acceptable. We must take urgent action to save life, increasing resilience to extreme weather events, reduce carbon emission, and reduce cost. And third, we must advocate for development and finance, climate finance that protect health now and in the future, with the people and the communities at the center of our policies and actions. As we prepare for COP28, I sincerely hope we all keep these priorities in our mind. The first ever dedicated Health Day at COP28 will be a historical momentum, if I may say, a historical chapter of our climate book, for all of us to advance our journey and to make a real change in climate and health. The Health Day is just a new starting point, but it set up a new journey for the future. Excellencies and colleagues, many lives and health of our future generations are at stake. Let's act urgently. The climate crisis is a health crisis. If we are talking about crisis, we need a crisis management mindset and sense of urgency to take action. If I may say, many people still feel climate change is somebody else's business, and sometimes still put mindset wait to see. But I urge everyone we take action. So I thank you very much for this opportunity for WHO to speak. Thank you.
And now, please welcome to stage the President of the Republic of Malawi, Dr. Lazarus Chakwera.
Excellencies, distinguished delegates, ladies and gentlemen, I've been looking forward to this discussion on advancing the speed and scale of climate adaptation support for health systems ever since I did not have an opportunity to join you when you started this conversation in Paris this past June. And I must commend Foundation S and the Africa-Europe Foundation for sustaining the momentum to ensure that we stay on course with what needs to be done to help communities adapt to climate risks that affect health system functionality and health service delivery. We all know that climate change is no longer a distant threat. But the fact is that the impact of climate change is more pronounced in developing countries like Malawi, which are not sufficiently resilient to climate shocks, especially in the health sector. On the Climate Change Index, Malawi is characterized as one of the most vulnerable nations. Since 1946, Malawi has experienced major droughts and floods and more than 600 disaster events. From 1980, there's been an increased frequency of extreme weather events and disasters in our country. For instance, since 2022, Malawi has been hit by tricyclones Ana, Gombe, and Freddy. The latter that hit the country early this year was the worst ever in the history of our country. causing the most devastating health impacts, apart from other forms of destruction. More than 2.2 million people were directly affected, out of which 659,278 were displaced, 679 were confirmed dead, 537 are still missing, and 2,178 were injured. The increased occurrence of natural calamities and disasters contribute to the worsening of people's health status, economic and social welfare, loss of life, and damaging of health infrastructure. Globally, the impacts of climate change on health systems are clear. They include increased incidence of climate-sensitive diseases, disruption of a continuum of care for the chronically ill and terminally ill people, loss of medical supplies, and a breakdown of cold chain, as well as loss and damage of health infrastructure and water, sanitation, as well as hygiene, wash facilities in communities. And to address these threats, we need to act with urgency and then collectively. We must prioritize the well-being of our communities and ensure that our adaptation strategies are equitable, leaving no one behind in addressing the threat of our existence. We need to develop short-term and long-term goals. In the short term, we must strengthen our preparedness and response mechanisms to climate-related health emergencies. This includes improving early warning alert and response systems, enhancing resilience in healthcare infrastructure, strengthening capacity building efforts at a community level, and amplifying the voice of children and women in climate action. Furthermore, we must invest in research and surveillance to develop targeted interventions and policies that address the specific needs of our communities, ensuring that health equity remains at the forefront of our efforts. In the long term, we must work towards transforming our societies and economies to reduce our carbon footprint, mitigate the impacts of climate change, and promote sustainable development. This requires transitioning to cleaner energy sources, promoting sustainable agriculture and urban planning, and fostering collaboration between sectors to achieve common goals. But these things must be driven by communities. We cannot expect meaningful change to happen without the active involvement and engagement of communities. Community-driven adaptation is the key to ensuring that interventions are context-specific, culturally appropriate, and responsive to the needs and challenges faced by different populations. To catalyze community adaptation for health equity, we need to strengthen partnerships and collaboration at all levels, uniting over a common vision and addressing urgent health challenges posed by climate change. In Malawi, we have adopted the following strategies and interventions in response to the challenges of climate change on health. We have developed contingency plans that include preparedness, response, and recovery activities. We have introduced climate change in health academia curricula. We have installed solar grids in health facilities in order to reduce carbon emissions and provide alternative energy sources to the grid power. We now aim to construct climate-resilient health infrastructure in sites less prone to disasters. We have strengthened existing structures for networking and coordination through a health and climate change core team. It is also worth noting or mentioning that my country already conducted the Vulnerability and Adaptation Assessment, V&A, on climate change and human health to form a basis for mitigation measures, such as those mentioned above. In conclusion, I'd like to emphasize the importance of strengthening multilateral and bilateral collaboration to effectively prepare and respond to these natural calamities and disasters. The adaptation and mitigation measures I have shared with you compel me to continue appealing to development partners and multilateral climate financing institutions, such as the Green Environment Fund, GEF, the Green Climate Fund, the Green Environmental Fund, GF, and then the Green Climate Fund, GCF. The Africa-Europe Foundation, the World Bank, and many others, to consider and facilitate access and procurement processes in the existing and new financing schemes, and funding for these climate change and health initiatives. That would be my plea, and I want to thank you all for your attention.
Please welcome to the stage the French Minister of State for Development, Francophonie, and International Partnerships, Krishula Zaharapoulou.
Merci. Mesdames et Messieurs, bonjour. Mr. President of Malawi, dear ministers, dear Vanina, and of course, dear friends, thank you. Thank you very much for organizing this event that shed light on absolutely crucial matters. Before to come here, as I was born in Greece, I was reading the journal, Greece, that had the storms 2 weeks ago. So the title was Greece warns of infectious disease after floods leave livestock dead. And of course, the President of Malawi, as he said, we had a global surge in cholera outbreaks that maybe the responsible will be the climate change. So, as a physician, I'm particularly sensible on this issue. We have actually two huge challenges. The health challenge, which was clearly highlighted by the COVID pandemic. Everybody understood that our life can change when we have a pandemic. And of course, the climate crisis challenge, if I can say, with huge negative effects, which are already dramatically real for our population. Across the world, these dramatic events underline how urgent it is to promote mitigation and adaptation policies. Above all, these two challenges are so closely linked. It is estimated that between 2030 and 2050, climate change will cause 250,000 more deaths from malnutrition, malaria, and temperature shocks. We also know that the emergence of new zoonoses that could reach the pandemic stage is likely to increase. So these two challenges must be tackled together. Climate action and health promotion and poverty alleviation are so linked. We don't want anyone to have to choose. That's why in Paris, we organize a summit for a new global financing pact on the 8th of June, where President Macron convened all of the community, head of states, philanthropists, scientific, to start to speak about the challenges, because human development and climate action are two faces of a same coin, and we should never oppose them. So we need to mobilize a lot of financial resources to address all of these challenges together. Is what President Macron said, we need a financial shock that is able to responding to all the new vulnerabilities and all the overlapping crises. We need this financial shock in order countries to invest in adaptation, in their green transition, but in the same time in their health systems, in universal health cover and social protection, and above all, in the training, Madame et Messieurs, of health professionals. It is crucial. The Paris Pact for People and the Planet, as we call it, which more than 30 countries have joined, promotes multiple solutions to achieve these goals. And we need all of us, and we need all states to do their part. I'd like to speak about my country. France does its own, in both sectors, on climate and on health. 6 billion euros of climate finance every year. In 2022, we did even more, 7.2 billion of euro, 25% more. And in this, including 2 billion for adaptation. And it's not only this. We have important contribution to global health funds, including more than 1.8 billion euros last year. President Macron announced here in New York to the Global Fund for HIV, malaria, and tuberculosis. And of course, you can imagine bilaterally, we contribute also always to the health sector. But we will need more. We will need more concessional finance from international financial institutions, and they are working to do so, particularly the World Bank. Following on the Paris Summit, G20 leaders 2 weeks ago have agreed to work together to unlock $200 billion of additional financing through the World Bank. And of course, health and climate change are key topics. But France is convinced that effective investment will require an integrated One Health approach. This will be one of the priority issues for us in the current overhaul of the global health architecture and the preparation of an international agreement on pandemics that is ongoing now in Geneva. Every health actor should increase its climate dimension, and every climate actor should increase its health dimension. It is also for this reason that France has launched the international PREZOD initiative, Preventing Emerging Zoonotic Diseases. It's to strengthen the links between research and operational action to prevent pandemics. 21 countries and more than 200 organizations, universities, research institutions have already expressed their support for PREZOD. But it's not enough. The One Health approach, it is fundamental. So I call all the actors to join this initiative and support these efforts. We also want to raise this issue, and the first Health and Climate Day in the history of the COPs at COP28 in Dubai. And as I said to Vanina, it was a personal engagement that when I exchanged with the person that organized the COP28. So it is a collective responsibility for governments, for philanthropists, for major international funds and businesses. We all have a part to play in the solution in terms of funding, technology, and even advocacy. I would particularly like to pay tribute to the commitment of private foundation and in particular Fondation S in this area. I like to say that as a doctor, as a physician, I always saw people come to the hospital when the disease is ongoing. The prevention that we have to invest and we continue to invest, maybe, I don't know, maybe we have to do more on this. It's the same things for the pandemics. So I hope that the lessons learned are very important for all of the governments all around the world. We saw the fragility of the health system, and we don't have to face in the same way the next time. We have the possibility to change the health for the people. So let's do it together. We have to continue this battle. Merci, merci beaucoup.
Next up, please welcome to the stage Minister Awa Marie Kalsek, the Minister of State of Senegal, Anil Soni, the CEO of the World Health Organization Foundation, and Dr. Vanessa Carey, the WHO Special Envoy for Climate and Health and CEO of Seed Global Health. This panel, Climate, Health, and Equity, Local Challenges and Solutions, will be moderated by FP's Vice President of Research for FP Analytics, Dr. Maisha Alam.
Good morning, and thank you so much for being here and for participating in this event today. It's my pleasure to welcome this illustrious panel and to have a critical discussion on scaling innovative solutions to local challenges. I think that the Accelerating Climate Adaptation for Health Equity report that's being launched today is very clear in its evidence and in its call to action. And it's really as simple as this, that people are going to die unless there is a mobilization of resources and a coming together of partnerships and a real commitment to action over the years to come. And that work needs to be targeted towards the most vulnerable communities across the world, and especially in low and middle income countries. So that's what brings us together. And for this discussion in particular, I'd love to actually begin with you, Minister. Having witnessed firsthand the health impacts of climate change in Senegal, ranging from the impacts of drought and rising sea levels on food security and nutrition, and the impact of rising temperatures on waterborne diseases, could you share your perspective on the urgency of this situation? And in particular, what are you most concerned with, and how are you hoping to address those challenges?
Thank you, and good morning, everybody. I would like, first of all, to say that I will be very concrete, because having been Minister of Senegal twice and for almost 8 years, I have been involved and really concretely in a lot of these impacts of climate change, which are very dramatic, but also very concerned when we look at the impact on communities. My first hand was when I was first Minister of Health in 2001. one of my first visit was to look at the population impacted by floods. And the point was that it was the first visit was a visit of Minister of Infrastructure, but after the President said, we need to have the Minister of Health there, because this is where the problem is. After that, we have been often involved every time we had this type of floods or rising of the ocean, level of the ocean. We were there to see what we can do. And what we witnessed was that the communities was always there. They are the one, when we look at adaptation, the adaptation is really at community level. And I think that this is where we need to put our focus. We can have a lot of recommendation and all this are global or at national level, but the things will change only if we have the community. We are the more vulnerable, the community who are also those who are really trying to do things. And the example for me is in Joal, one of the towns in the sea, just on the border, where you have women movement, having see that when they transplant mangroves, they see that the sea is not coming to their house, and they take the initiative to do that. I just want to say that we can speak on that for a long time, but I wanted just to highlight that the community need to be really at the beginning and at the end. We need to put them in all the process. If it is a process of doing a diagnostic, they are the ones who are there. If we need to have policy or policy changes, they need to be involved. For the implementation also they are there. But one of their problems is that they are often doing things at small scales. And one of the challenge is to go to scale. We cannot resolve the problem of climate change and its impact, particularly on health, if you do that just at the level of a village. You need to do that everywhere it's needed. But I want to say also that I have been shocked being also a professor of infectious diseases. When I was teaching, it was almost never developed some issues like dengue, or malaria was in some zone only. But today, with the climate change, what we have seen also in our countries and in Senegal in particular, is that a lot of new disease, which was just anecdotal, but now they are real. Dengue, Marburg, everything. All the things we were teaching is now a real issue, and it is linked to the climate change also. So this is what I wanted to say, and I hope I will come back, because one of my challenge and the challenge of the community is financing. And I hope I will have time to discuss this.
Absolutely. No, and thank you for, providing that very vivid picture of what the reality is, but also I think something that you highlighted that's so important is the ways in which the communities are already on the front lines of change and are making a difference, whether it's the mangroves or any other solutions, and that their voices and perspectives are so important. Vanessa, I'd love to go to you next and talk a little bit about what systemic change looks like and how we bring that about. And in particular, let me ask you this. What role do health systems strengthening universal health coverage, which is of course high on the agenda currently, and having a resilient health workforce have to do with climate adaptation? Can you help us bring those pieces together and understand what that looks like when put into action?
Absolutely. You asked me my favorite subject, which is strong health systems. It goes without saying, and every single person in this room and online knows this, but we are dying every single day from climate change. Every headline, everything we read about, every experience we are having is being driven by climate change. The statistic I'm sure you've all heard, 7 million people are dying a year from air pollution. That is more than the entire COVID pandemic. And we're just seeing that in a single year. 5 million from extreme heat. But statistics aren't actually, and we're here to talk about communities, right? But we're actually here to talk about individuals. I'm a physician. This is about patients and people. So I want to tell a quick story before I come back to why the health systems matter in this. But I was putting my 8-year-old daughter to bed in this past week, and she told me she couldn't sleep. And I asked her why, and she said, because I'm terrified the world is ending. And I said, okay, do you want to talk about it? And she said, no. I said, okay, do you want to write it so it gets out of your body and you get out of your mind? She goes, sure, I'll write about it. So she writes, she crosses it out. She says, Mom, don't read it. I'm sorry, my love. I did totally betray you, and I read it. It said death. It said the world is ending. It said oceans. All of this crossed out. And she was able to roll over and go to sleep. That same day, a single storm swept 20,000 people out to sea in Libya, and there's a mother who is not putting her child to bed, not just because the child is dead, but because the mother is dead, because the whole family is dead. And with all due respect, we are all sitting in this room now, comfortable, with a huge amount of power to create change. And that's ultimately what I'm going to ask us all to do, because these statistics of climate change, this is not a new story in some ways. We've been dealing with climate change for a long time, but dying from disease, because climate change drives death through non-communicable disease, through maternal health and maternal mortality that isn't doing well, mental health burdens that people are taking their own lives, through vector-borne diseases, as we heard about, all of which is accelerating. And the reality is the only way we are going to be prepared to manage that myriad and broad and growing disease is if we drive adaptation through strong health systems, building a health workforce that can not only deliver a child, but can manage somebody's hypertension, can treat malaria, can vaccinate a child, and can create. We can do this because my colleague here from Zambia and my colleague here from Sierra Leone are doing this every day, building strong health systems. So we know how to do it. It's a question of committing ourselves to doing it, mobilizing the finances and deciding there is no such thing as too ambitious for this moment. We have no choice, so we have to stop producing greenhouse gases, which are causing harm. And we have to invest in the adaptation for this moment because we are dying daily. And that is the most efficient way to do that, is to build strong health systems, primary care, and make these investments that we know work. We've just chosen not to make in the past. We have to choose differently.
Thank you, Vanessa. And I think the other thing that, to underscore the point that you made about the story, which is so powerful, as the report states very clearly, we're talking an excess deaths of 250,000. That's what the World Health Organization is projecting, right? And it's projecting, but we know that these climatic disasters are occurring more and more frequently. And
that's an older statistic, too. That is from 2014. So we don't even know, I think. There's a huge opportunity for us to understand this more. And the World Health Organization has been driving an incredible amount of work on that.
Exactly. And as you were pointing out, all of this is going to take money. It's going to take investment. It's going to take changing the way that we work. And Anil, I'd love to bring you in on that point. And in particular, you lead the World Health Organization Foundation, which requires you to not only grapple with the range of challenges that she was talking about, but also to work with stakeholders from the private sector, from the public sector, civil society. So what is required, in your view, to enhance the quantity, the quality, and access to adaptation finance for health systems? And what's the role of cross-sectoral partnerships to that end?
A few things, and I risk being in a position in a room full of people like this telling you we need more money, and of course we need more money. So I'll say a few things. First, I think we have to radically reshift how we think about this concept of competing priorities. We do not have competing priorities. This is a single priority. As Vanessa and Awa have shared, and of course as the WHO shares, climate change, the climate crisis is a health crisis. And I think we have to recalculate our numbers so that we can be clear that climate change is costing millions of lives right now. This is not a future threat threat. This is a threat now. And the reason I say this is because the excuse is that aid budgets are constrained. We don't have enough resources. And so we have to choose where do those resources go. And this idea that we're competing with one another, we have to really dismantle that as a concept. Secondly, we need resources from all the places that we can get them. Of course, we need government resources, and local governments are contributing substantially. We need a lot more from donor governments who can't, and we have to, as stakeholders, because of course these are elected officials, we have to let them know that there's no excuse not to allocate greater resources because this is a current crisis. We need resources from companies. We need companies to make sure that they're going to net zero. We need to make sure that they're using their balance sheet, that their investments are consistent with their rhetoric. We need money from philanthropy. And philanthropy is so critical because it can take the big bets. It can take the risks. So much of what we needs to be financed, as Vanessa has clearly said, we already know works. We need healthcare workers. We need resilient health systems. And we need new technologies, and we need new approaches. And so we absolutely need philanthropy to take those bets. We need investment income. So much of climate finance that's been mobilized in North America and Europe has stayed in North America and Europe. And we need that to shift. We need to actually be putting return-seeking capital to work in the low and middle-income countries where you know best, local knows best. So we need money from all of those sources. Third, where is that money going? And this is where I think I'm hoping to hear more from Awa, because I think you need to pound the table with us. And this is one of the beautiful things about the report. The language of this report is actually quite bold. And it's telling us 25 years into an incredible period of global health where we had a lot of financing that we've put to work, we need not just more, but we need it to be fundamentally more flexible, and we need it to be going towards local communities. We cannot be saying, please write us a big grant report and tell us how you're going to use incrementally more money. This is not the stage for that. We need flexible financing going directly to local communities. So we need all of that. And what I'll share to give credit where it's due this week is, what does that look like in practice? And I just want to give credit to Sanofi and Foundation S. They convened the council that Awa and Vanessa and I are on, but they wrote the check. And yesterday they announced that they're putting 500 million euros to work to do both of these things, to make sure that they're going to net zero by 2030, and to put 10% of the resources that they committed to local communities to flexible financing. That's an incredible model, and I hope other companies take note.
Thank you for that. Thank you for that. And I think one of the most important things you said was towards the end, when you made the point about flexible financing, not just having financing available and when it's needed, but that it's flexible. And Minister, I'd love to bring you in on this point, and in particular, to hear from you about the kind of resource mobilization that you would like to see in order to be able to tackle the challenges that you highlighted at the outset.
We will need, as you said, resources. But they need, as you said, also to be flexible. We don't need to have resources. We will take 1 year or 2 years to write proposal to have access to that. And after, a lot of elements to evaluate every day or every week, it's too much. This will not change anything. And it is an emergency. And we need also to ensure that everything we have already said is made into practice. When we look at the Paris Declaration, it was already there. But we have seen that things have not moved as we wanted. But Anil, I am very happy for you. You open the door to everybody. We need to ensure that people will not say, we didn't know that we were able to help on this. Everybody can help. For people to have grants, to be able to channel it to local level. This is not also something to stay at national level and people do what they want. They need to channel it where we have problems. But I want also to highlight the last point is the issue of debt. The countries has used a lot of debt to try to resolve this problem of climate change, particularly the flood. And when I look at my country, it's a lot of money people have put on infrastructure, etc. And until now, we have floods, and the population has to go in other places and are saying, what is this? You told us that a lot of money is there, but we don't see anything. Okay, we see big things, but we need small things at the level of community. And it is why, for me, the issue of countries having gone to have death, and after the money is not reaching the community is an issue. We need to change our mindset, change the way we are working, because we need to put the money where people need it and where they are able to show changes and to show really advancement on the adaptation. And it is there at community level. Thank you.
Thank you. And I know we're almost out of time. So very quickly, Vanessa and Anil, I'd love to bring you in on one last point, and in particular, the importance of integrating local voices and local perspectives into the decision-making process, into the design of solutions. Could you very quickly just comment on that before we wrap up?
Well, I think this is the power of the report, and what is the beginning of a journey that we've been able to be a part of, is to really highlight that exact point, that when you have local voices, and you heard the president of Malawi speak, he is an advocate for his population and the really deep experience of how they are at the interface of climate change and the need for health. And so I think what we have learned in the work that we do at Seed Global Health is that when we partner with our folks, with the governments and with the institutions and with the patients and the caregivers on the ground, we are in much better service to their priorities, and the work that we do is going to be in service to that context, and that it lasts longer, it is shared, and most importantly, it's responding to their needs. And I think that if we can help be a part of changing that conversation more broadly, so that we are all taking that viewpoint, then we are going to get to a world where we're going to close equity gaps, we're going to close the fact that there's just two standards of care in the world, and we're going to start to do and live a path of true justice that we have not taken for far too long, and that is hurting all of us, and is just fundamentally unacceptable and wrong.
There's a red screen.
I know, the red screen's a lot.
But I'm nonetheless, I'm going to take a minute, because Awa talked about debt, and Vanessa talked about justice, and I just need to say a word about this. The fact that ministers like Awa or President Chakwera are dealing with debt, that there's money given, and it's, we'll give you the money, but you need to pay us back, it's your debt to pay us, is backwards. We have a debt to the very settings and communities where resources have been extracted for hundreds of years to drive an industrial revolution that has created the emissions that allows us to sit in this nice room, and where those emissions are having a disproportionate impact on the very communities where the resources were originally stolen. And I say that because we have a debt. I have a debt. I have a debt to Awa and the communities that Awa leads. So when we talk about debt and when we talk about justice, let's be clear that the climate crisis is an opportunity for us to lead through restorative justice and pay the debt back to the very places where the resources were extracted to create this nice, cushy life that we lead. So it's our debt.
Thank you for that reality check and that really important point. I want to thank everybody for being here and for our panel for this really important discussion. I encourage you to take a look at the report on our website, and please do engage with its content, which is so important. Thank you very much.
And now, please welcome to the stage Josep Katla, the Head of Communications and Corporate Affairs at Sanofi, and Holly Renavuzini, the Head of Outreach, Advocacy and Partnerships at the Africa Europe Foundation, for a concluding discussion with FP's Andrew Solinger.
And what we wanted to do was actually shorten this so that it's not a conversation, because we had such outstanding comments from all of our speakers, the president of Malawi, the minister, that we're a little short of time. So instead, what I'd like to do is simply ask our partners, Oli Rene Vozenini of AF, to talk a little bit about the role of cross-continental health partnerships just for a few minutes, and then we'll hear from Josep as well.
Yeah, thank you very much. I think just 3 quick points from the Africa-Europe perspective. So I think we have commitment first. We need to kind of remain committed, of course, into driving this climate health nexus into the global conversation, and as well to really make sure that we need this enhanced action, collaboration, ambition, and as well commitment for this to make it happen, and particularly to actually deliver on the finance issues that we've been talking about. The second point is very much about the momentum, because I think this is the right time to kind of drive this agenda forward. So this is also a call for action, for collaboration with everyone. And the third point, the last one, is about leadership. So I think we need to see the leadership at the political level, but as well leadership from different stakeholders, so that we are in this together.
Outstanding. Thank you for those comments. Yes, sir?
Yeah, thank you. Thank you for that. Maybe I'll just say 2 things, 2 quick messages from the private sector perspective, if you want. The first thing is what can we do to help? And I think the first thing I would say is that we need to get our house in order before we start giving lessons to anyone else. And getting the house in order actually means to do what we need to do to mitigate the CO2 emissions that we provide to the environment, or how we make our planet a bit less in danger. And that, in that sense, and I think Anil made the statement before on our behalf, but Sanofi was proud to announce this week that we're investing some 500 million additional in order to make sure that we reach the carbon neutrality that we've committed to. But most important for me is that we're also working with our suppliers and our partners to make sure that they do their homework if they want to continue working with us. Because if they don't cover their scope 1 and 2, we're never going to make our scope 3 to get to net zero. So that's a strong commitment from the company perspective. On the second thing that we can make, the second thing that I think the private sector needs to do is start being serious about investing where innovative solutions are found. And this is why I like to applaud the work that has been done by the Collective Minds think tank on this report, which not only talks about the problems, but also outlines the solutions. And again, if we do our work on mitigation, if we do our work in decarbonization of the healthcare systems, by the way, I think Vanina mentioned it at the beginning also, 5% of the CO2 emissions in the world are done by healthcare system, which is probably more than the airline industry altogether. And we have a lot to do there to reduce those emissions. By the way, we will provide that patient care path. And then the final thing is the adaptation and contributing to the local communities and the local initiatives that we see. But I would dare to say, let's invest in healthcare, not only in the low and middle income countries that we will do, and I'll come back to a second. But if we look at our part of the world, I live in Paris, in France, and if you look at the healthcare systems in Europe, European governments have stopped investing, actually have reduced investment in healthcare over the last 10 years. And where you see after the COVID pandemic is that you see probably the workforce that is struggling to continue to deliver healthcare to patients. You see infrastructures that need more investment. So it happens everywhere in the world. Today we're talking more about the low and middle income countries. And this is where we, and again, Foundation S has mentioned the investments we're making there. And that's why we need to play our part as well. We need to continue investing there where the communities need to do what they can to actually adapt. So in terms of adaptation on the climate change that has become the new health crisis. I would dare also to say at the end, just to close, that for those people who keep saying that climate change will start having devastating efforts or consequences, in 2050, I would ask them to stop saying that. And probably talk to the people in Hawaii or in Greece or in Senegal, in Malawi also, and recently Morocco and Libya. Those people have suffered the climate change consequences in the healthcare systems already today. So we should stop talking about 2050, we talk about 2023, because that's when it has started. So thank you very much.
Powerful words. Thank you for that. As Vanessa Carey said, climate is killing us every day, and that point has really been brought home. I want to thank you both for your partnership. This was a fantastic event, wonderful conversations and comments from the minister and others. We really appreciate your time and your energy and your focus on this incredibly important issue. So thank you so much. I want to invite you all to stay for the health forum that we're going to be kicking off in about half an hour. I hope you will all stay for that. We do want to clean the room, however, and change a few things up. There are a few coffee cups around. If you want to keep your seat, you can keep your gear at your seat, but we will be picking up and bussing and all that sort of stuff. But please, we have refreshments, coffee. There's plenty of networking you can do. We'll be back here at 10:30 for the start of our health forum. Thank you so much.